what is the worst thing that can happen? And that is like your core fear that now you've exposed it and now we can also break it down.
Yeah, I say that a lot too. Let's break this down because altogether it just seems overwhelming and it's catastrophic. But when we start to break it down, that actually feels a bit different. I can approach this thing differently.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
All right, welcome back, Andrew.
Thank you, Dave. We're back. Part 2 of anxiety today.
Yeah, let's get back at it. I actually want to go through a couple resources just off the hop because I feel like we won't cover everything in my own anxiety while I'm doing this podcast. We'll settle a bit if I do that, and I'll be more present. And yeah, what do you think about that?
Sounds good.
Okay, so one that I love that I've been using for years that I share with tons of people, and it really does walk through a lot of the psychoeducation about anxiety, all the way from like different diagnoses to treatments, medication. Yeah, and it's evolved over the years. I think it's on its like 8th edition. So that one is the Anxiety and Phobia Workbook. And you don't need to get the most current edition, but it has kind of updated as the research has updated. But you can find these books. I remember one of the first ones I found was at Costco, and it was like very reasonably priced. And the other one for anxiety, for panic attacks, when panic hits, or with David Burns.
Yeah.
And David
When
Burns.
panic attacks.
Yeah, when panic attacks.
Yeah. And I also have the anti-anxiety workbook by Anthony and Norton. So that's another one that I've pulled different resources from there. That's been helpful.
And I think the other thing, like people will, like I said, there's tons of material out there. I think just a quick search online will give you a ton of strategies, a ton of different, like, that'll probably complement a lot of what we've been talking about, but hopefully this provides some context to it. One of the ways that I kind of make sense of all of the different strategies or even theoretical or therapy approaches to working with anxiety is either they're like bottom up strategies or top down strategies.
Mm-hmm.
And the bottom up is like the body based. So the mindfulness, the connecting with your like even just humming or your breathing. There's different ways to kind of self-soothe and soothe the nervous system that, yeah, you can really kind of work at practicing this on a regular basis that will help reduce the overall kind of generalized anxiety. And in the moment, like in the moment of panic or stress, we can use some of these techniques, right? And I do this all the time. I'll be breathing, or even like tactile stuff, like,
Yeah.
yeah, certain parts of your body. And anyways, there's tons of resources out there like that. I think more so than there ever has been. Probably most of the resources, at least from like the cognitive behavioral approach, have been cognitive. So that's what I consider the top down. So looking at your thinking, changing your thinking, questioning your thinking, all of those can help kind of like from the top soothe the nervous system and your body.
So some of those other strategies too, and I've always found with clients, it can be difficult for them to initiate themselves. If we talk about relaxation strategies like breathing, any kind of meditative exercise, progressive muscle relaxation, it's great to do in the session, but I've had many clients tell me how much more difficult it is when they have to try it on their own. I don't know if you've come across that.
I have, and just like personally, I kind of have mixed emotions about it. In some ways, I feel like it's at this point because there's so much out there on YouTube and other, like there's even an app that I like it was called the COVID Coach. I think they're trying to change the name of it, but it had a ton of different like guided kind of progressive muscle relaxation or mindfulness audios. So I feel like people can do this outside of the office, but
Mhm.
also it's really important to practice and to model and to do it. So depending on the person, we'll either do it in the office or I'll direct them to a resource that they can be practicing outside of the office. And if they need support, kind of like with any kind of problems that are coming up with it, then we can focus on that in our session.
Exactly. I've actually had clients ask if I could record my voice to guide them through certain exercises. Because I guess this is interesting, actually. I've never thought about this, but I wonder, just in terms of the comfort level of being in the presence of your therapist
Hmm.
in the setting that you're in, that office space or that environment, like all of that when you first start practicing, you just get habituated to doing it there.
Yeah. Oh, geez. When you said that, that brought up a thing from my training. And in our training, like you'll remember from the clinic, we had like video recorded sessions that would be reviewed by our supervisors. And I remember I was working with this one client, and the client would yawn a lot in the session. And I interpreted that as being bored, disinterested, kind of waiting for the time to pass by. But my supervisor saw that and she was like, that's anxiety. Like this client is managing their anxiety by yawning. And I was like, oh, that's really interesting. Like I never would have thought that. And now that I know that, I can see it a lot more, right? Like, how do they call it like down regulate. Like, sometimes it's just swallowing, sometimes it's yawning, sometimes it's fidgeting. Like, people are actually quite anxious and they're trying to reduce their anxiety, but it might not look like that, right? Like, yawning is like, oh, this person is tired, right? No.
Yep. It's like the nervous laughter.
Hmm.
That nervous laughter as you're talking about things that might be challenging. And I've had therapists tell me, like, again, people who I supervise, they might feel a little bit insulted if they see this sort of smile, snicker, laughter. And it's like, hold on a second, right? That laughter, maybe a nervous laughter, as you approach something that's getting more challenging, it's their automatic response.
Yeah, it's uncomfortable or it's scary, and then it looks like they're not taking it seriously, right? Like our interpretations again of the behavior, I think it's really kind of it's interesting. And I think about this too in terms of we have that other episode on like attachment. And if you look at like the avoidant attachment, right,
Mhm.
style, what happens there is that on the inside, you can be freaking out. Your nervous system can be really firing, but on the outside, it looks quite calm and cool, right?
Yeah.
It can be that freeze response that on the outside looks like nothing's happening on the inside. But actually, right, that is how some people have uh, we have different ways of doing it, but like that is how some people respond to threat, respond to anxiety. And so seeing that, not assuming that just because someone looks calm, they actually are calm.
That's usually one of the initial approaches to working with anxiety is relaxing the body, right? Trying to relax the mind a little bit, but it's certainly not the be all and end all.
No.
Right. So if you go to a therapist who only works on that,
Yeah.
be wary.
Yeah, again, there's many ways, just like a lot of other, things that people go to counseling for, look for psychological help with. There are many different approaches to address the same concern. So, but I think actually just thinking about this, a lot of people that come to the office for the first time that haven't done any therapy for anxiety, my experience has been it's because it's affected their sleep so much. They either can't fall asleep, can't stay asleep, waking up really early. That is one thing that I think, might cue someone to be like, "Oh, am I anxious? Am I worried about something?"
Well, that's why in the last episode we talked about those body cues, right? Is that recognition. right? And so even in my work with clients, children too, like we'll draw a picture of the body and then we'll sort of put an X or a star on the part of the body that feels uncomfortable when we start to get nervous or anxious to help recognize, okay, when I start to feel that, I can now name it, right? So I
Hmm.
feel it and I name it, right? That is anxiety.
Yeah, and especially with panic attacks, right? That is one of the ways to kind of cope with panic attacks is to be able to recognize it as a panic attack.
Yeah,
Or like some people will even call it like an anxiety attack, right? There's a
exactly.
difference, but to recognize that this is anxiety, this is not like a physical concern, like a heart attack or
Hmm.
right? Because it can be interpreted as like I'm dying or something terrible is happening to my body right now. I need to go to the hospital, right? And so many people are embarrassed that they've gone to the ER and they were kind of dismissed in a way. It's like, oh, it was just anxiety. And they feel like ashamed that, but I mean, you need to go to the hospital if you feel like you're having a heart attack, right? Like you need to rule out those physical things. And then once you have that information that this is anxiety, now you can start to kind of name it as anxiety and cope with it as anxiety.
I think that's why, like, the recognition of the body cues to know that it's anxiety, like you said, people end up in the ER thinking that they have some sort of illness, and that in and of itself, the worry about the somatic cues, can be very debilitating, right?
Mhm.
The number of people who will tell me that, that they can't go into the office or can't go to school because they're afraid that they'll just be sitting in the washroom all day, right? With an irritable bowel. But then when they don't have to go into work and they can work from home, like there's no issues with the bowel, right? So that's really interesting. And that's sort of some of the first cues that, okay, maybe something else is going on.
Yeah, but it could be, did I eat something bad? Right. And
Yeah.
so there's a lot of like kind of sorting out. And
Yeah.
then once you get to a point where you're pretty sure that, like, oh, this is actually anxiety. But
Yeah.
anxiety can be sneaky. It can like kind of creep up and not always be just like connected to something scary. Right.
Well, I think it's also important to note, like, even in this part of the episode, that it is important to get checked out
Yeah.
by your family doctor or your child's pediatrician just to rule out anything that may be happening in your body, right? That's very real. So we don't want to dismiss that either.
No, and I think some of that process is, I mean, we do this all the time, but with a possibly with a therapist, you can start to rule out, start to ask those questions and sort out what is actually going on for me right now.
I know that we wanted to introduce some of the different types of anxiety disorders. There are so many different types. So it's important to note that, there's no diagnosis for just anxiety. When we do an assessment or if a psychiatrist were to do an assessment, they would narrow that anxiety down to a more specific type of anxiety. So I know, Dave, you mentioned in the last episode you used the term generalized anxiety disorder.
Yeah, I mean, there's a bit of a pet peeve of mine in terms of the diagnostic criteria that maybe I don't know, I'll say it here, but really, when we're looking at anxiety for a lot of people, we're looking at generalized anxiety versus panic disorder. And if you haven't had a panic attack, then you wouldn't qualify for the panic disorder. And generalized anxiety is like a lower grade, constant anxiety that happens, almost every day. I'm not going to go through the specific criteria, but yeah, it's excessive worry, right? And you're objectively, compared to other people, the amount of worry you have for the events that are happening seems to be more extreme. And we've talked about it all through the other episode. Like in terms of how much it debilitates you or how much it negatively affects your life is really kind of really important, right? You can be kind of worried about a lot of things, but if it's not negatively affecting your life, then you're not going to get this, diagnosis, and you might not even seek treatment or support for it.
I think also when you notice that everything becomes a bit of a spiral, and maybe everything is a bit of an exaggeration, but when many things that are worries just continue to constantly spiral. So, you might be worried about your child going to school and thinking that they might get in trouble. And then you're also worried about, well, I need to go into the office and do this. And then again, spiraling thoughts that, oh, if I don't go in, the office is going to fall apart without me. Just every worry becomes the biggest black cloud above you. That's sort of how I sort of see generalized anxiety.
Yeah, and it becomes difficult to control. Like the individual struggles with being able to manage that anxiety and control that anxiety. And another important part in terms of like an actual diagnosis, it has to be for 6 months or longer, right? So this isn't something that just, you know, rolls around a big event in your life or, this is something that is persistent, consistent, and yeah, I mean, I think we've covered most of the other stuff, but
Yep.
in terms of my pet peeve, like with depression, you can be diagnosed with major depressive disorder, right? And there's no major anxiety disorder, right? So there's an equivalent with depression with the persistent depressive disorder as kind of that generalized anxiety disorder is in my brain. But I feel like some people get missed if they have a lot of anxiety, but it's not as persistent. It might only last like, a month or 2 weeks, but it really is debilitating, but they haven't had panic attacks, right? So those folks kind of fall through the cracks in terms of like the diagnostic criteria.
No, it's definitely a pet peeve of mine as well. And I've seen individuals when I'm doing an assessment and they've had a previous assessment fall through the cracks because of that.
Hmm.
And then we can get into more specific phobias,
Yeah.
right? So we've got generalized anxiety, as the name implies, it's general. And then now we're getting to, as the name implies, specific fears, specific phobias. And there's so many. I don't even know where to start, Dave.
Yeah, no, I don't think we have to go through each of them, but people will identify those more easily, right? It's
Yeah.
like a fear of spiders or a fear of heights or a fear like and they will I think it's sometimes easier when the anxiety is attached to a specific thing or event, right? And then getting really, again, we talked about kind of exposure therapy. That's pretty much like a lot of the treatment is around kind of being with that thing that is scary and letting those feelings be there and watching them dissipate and go away and like kind of training your nervous system to know that a bad thing won't happen, right? And you can do that imaginally, like you can start with like a graduated exposure treatment plan, or you can do the flooding where you just full on like if you're scared of spiders, you have spiders crawling all over your body like that. I mean, I don't recommend that, but that is an approach to reducing the phobia or the anxiety around, say, spiders.
I would say that I've never had anybody choose the flooding option.
Nobody with
Um,
anxiety chooses to dive into the deep end, right? Like, yeah,
yes. Like it's scary. It really
yeah,
is scary, right? And
yeah.
if you put, like we were saying, put yourself in somebody else's shoes who's struggling with this particular fear or anxiety, it's really scary. It's very real,
Hmm.
right? Yeah. So, but what I have done in the past is okay, as a very beginning, let's read some books on spiders, or let's watch a couple of videos about snakes, right? And, not videos about how snakes attack people, obviously, but maybe just some factual videos about snakes and how they help the environment, whatever ecosystem they're living in. So then you just get exposed to the pictures, the actions, the movements of snakes, and so on. And then you graduate perhaps to then going to the zoo and going through the reptile section and taking a look at the snakes there.
Yeah, okay, so we generalize anxiety, panic disorder, specific phobias, and then the other one that's really common is social anxiety,
Yep.
right? And forget what there was some like research study around how terrifying like public speaking is for people. Like it's just
Hmm.
below death in terms
Hmm.
of like common fears for people. And so I think we all have some degree of anxiety or some degree of discomfort, being around other people that we think might be judging us or
Hmm.
evaluating us. But for this diagnosis, it is like a really significant anxiety that prevents people from, going to social events or being around other people, even if they really want to, right? And
Yeah.
so there is that I mean, the name of it kind of explains itself. So when people hear of social anxiety disorder, they're like, okay, I get that. I can understand what that might involve. And then the specific diagnostic criteria might be more specific than that. But yeah.
I find with this particular one, there is so much about judgment and perceived criticism. That you walk out into public or you go to school or work, and it's like, I believe so and so is going to look down on me because of what I'm wearing or how I'm performing, and there's so much perceived judgment and self-criticism. So yeah.
Well, and it reinforces itself, right? So if you have an idea that it's your appearance, you don't look good enough, or it's your weight, or it's your maybe your intelligence, or maybe like these parts of yourself that you feel like you are going to be rejected by others or, about it, right?
Hmm.
And if we don't really test it out, we can just continue to think like, oh, that person didn't talk to me because I look like this, or they didn't talk to me because. And so a lot of therapy is kind of like testing out those theories about why you think or what do you think people are judging you. And even in therapy, you might explore that with the therapist, right? Like, what's your impression of me? And then be able to take in that information.
Exactly. So another one that is sometimes seen as related is agoraphobia. So that one I do come across relatively often for anxiety, fear of public spaces, open spaces, crowds, being outside an open space alone. And it's really about this idea of, this fear that escape is going to be very tough. You have individuals who may go into, let's say, an auditorium, and they're looking for exit signs, right? They're sitting right by the exits, right? So I've been told it's that feeling of just feeling like the walls are caving in,
Oh, okay.
right? And it's like having no escape. It's just the feeling of helplessness when we're alone, when we are in a public space. And again, it can be accompanied by this feeling of perceived judgment again, right? So if people start looking at me, where can I escape to? Or will there be an escape?
Well, and this is one that is not self-explanatory, right? Like if you say what's agoraphobia, most people will not have an answer for that, right?
That's
So
right.
and it's a bit confusing because you said it's like fear of open spaces, but also fear of being trapped or like in an enclosed space, right? Both of those fit within this definition of this disorder. And this, people, I haven't, yeah, I don't know if I've even had one client that has been diagnosed with this. So I'm not going to speak from experience, but my understanding is that folks that have this diagnosis have a really hard time like leaving their house, right?
Hmm.
So going to therapy at a therapy office is going to be really difficult. Yeah.
So it's different in the sense with social anxieties because individuals with agoraphobia, they will be fine to, let's say, have people come to their place.
Hmm.
And then in their comfort zone, they can socialize, they seem like themselves. And so they're not so much afraid of other people or fearful of other people.
Hmm.
But then when you ask them, hey, meet me at this restaurant, it can be misinterpreted as social anxiety, but it's not so much the people, it's more so about the space, right? I'm unfamiliar with this space. I'm worried about what might happen when I'm there. Is it a safe place to be? Right? Is there an exit that's accessible as quickly as possible if I need it? Right. So there's that difference right there in terms of not so much the social piece, it's more so about the environmental piece.
So again, there's tons of specific resources out there. Feel free to do a deeper dive. Maybe just quickly we'll mention like separation anxiety. That one too is kind of self-explanatory when you know that it's, separation between a child and an adult, right? A caregiver. We all know kids that have struggled with like not wanting to go. Like again, just had the spring concert at school and I saw a lot of kids, right, that were having a hard time going into the room they were supposed to meet with their classmates before the big concert started, right? and there was some kids in tears and other parents comforting their kids and trying to help them, support them to be able to do this thing that's scary for them. So yeah, leaving kids at school, leaving kids at other places. Again, it has to be to a significant amount where it's
Yep.
interfering to a certain degree. But okay, so separation anxiety, selective mutism. I don't come across this a lot, so maybe you have more experience with this.
So it's not talking, verbalizing, vocalizing within, again, a certain environment with certain people, right? So, I've come across kids who will be very talkative with parents, at home with siblings, but get to school and they won't make a peep. Their discomfort in certain environments that causes them to not be able to have that speech or that ability to verbalize what they need, what they want, what they're thinking. And certainly, I think for, especially in the school setting, it can be very frustrating for educators. Because again, we're going to fix it mode, right? Like, how can I help the student? And they think it's on them to help the student. But in my experience, there's so many other things that can be going on for that student. And it's not so much that they're completely uncomfortable with this teacher. You know, there may be other peers that they're uncomfortable around. Maybe something else is happening at home. And it can be related also to the separation anxiety too. So this is where anxiety, it's so complex in the sense that there can be all sorts of interrelated anxiety disorders too. It's not just like you have this and don't have anything else. You can have multiple anxiety disorders.
Yeah, it is complex and it's not always straightforward. I love the diagnoses that are more straightforward, like
I
selective
know.
mutism. Like I get that. It's not this person can't speak ever. It's in certain circumstances, right? Whether it's at school for a kid or in public for other kids, or even, I don't know, can an adult be diagnosed with selective mutism? I don't think so, right?
I've never come across that.
Yeah.
Yeah.
Okay. But you know what? Oh, you were talking about kids at school and you like it can be complex, but it like anxiety can present differently, right? And so I think about doing like psychoed assessments with kids and really a lot of times looking at this kid has attention challenges, right? They have difficulty with attention or sustained attention, but that could be, ADHD, but it could be anxiety, right? So someone's anxiety can interfere with their ability to attend and pay attention and learn, right? And so really looking at like what is the cause of this attention problem? And I think we do this in different ways with different diagnoses, but yeah, anxiety can kind of look like other things.
Yes. So that's why in my assessments, and I try to also communicate this to my team, it's so important to do a good differential diagnosis. And it's not to say that anxiety and ADHD can't come together. They can. But I don't want the assessment to become a default where, well, you're presenting this way and therefore I'm just going to include all these different diagnoses. There may be one diagnosis that explains things better than another, right? And if we just list it all under one roof, if a parent brings the assessment to a family doctor or pediatrician and they see ADHD and anxiety, they start prescribing ADHD medication, anxiety medication. One of them might actually be pretty useless because, like you said, maybe anxiety is the primary cause of a lot of these symptoms happening, right? And obviously, we don't want to over medicate teens and kids, let alone adults. But if we don't do a really thorough differential, that's what can happen.
Yeah. Well, and I think, with anxiety, it's very treatable, right? Like it
Mhm.
is something that in a lot of the research and it's one thing that people find reassuring if they are diagnosed with an anxiety disorder is that it is really treatable. Like you can actually do a lot to change how much anxiety is affecting your life in a negative way, right? And so it's more variable than some of these other diagnoses that tend to be really kind of consistent and not very responsive to changing the way you're thinking, right?
So, speaking of treatments, different kinds of treatments. I know we talked about CBT and, yeah, talked about the downward arrow. And what do you think about reframing thoughts and in your experience, clinical experience, how easy is it for a person to reframe thoughts?
Yeah. I mean, it's not easy, right? It's so much of our thought process is automatic, right? And it feels true. It feels like that's the way it is. And so, helping people to even just like get away from black and white thinking, right? It's either all good or all bad, or I'm either, yeah. So that that can be hard, but once it's learned, once it's a skill, once it's a practice, it's like, oh, how do I reframe this? Right? Or how do I see this in a different way, even though the facts stay the same?
It's their reality, right? It's their reality and how they're interpreting that reality. So it does take a lot of work, the idea of looking for evidence to either support or not support that experience that they're having or those thoughts that they're having. I find with many clients, it's the consistency of practicing. That's the hardest part.
Yeah, and I think you said it's their reality, and ah, it can almost feel like it's us, like it's a part of us that will never be different, right? And so, but I think when we're looking at the evidence, we're saying, okay, well, that's interesting that you see it like that, right? And one of the things I always think about, like we have this really strong confirmation bias, like we look to confirm what we think is true or what we think we know. That is just like a bias that most humans have. So if we think people are going to reject us because of the way we look, when someone rejects us, we say, "See, I knew it. It's because of the way I looked," or they look for evidence that that might be true, rather than looking for contrary evidence, right? And so that is something that is like again a skill, but it's like it's kind of the scientific method. It's like the null hypothesis where you're like, how do I prove that this isn't true? Right? That right? What is the evidence that would show that this belief I have is not true? Oh, well, actually, right? And then you can start to see it.
Yeah. And I think just like everything else, it does take practice. Like probably the clients who are the most successful, working on their anxiety are the ones who will practice looking for the evidence or not looking for the evidence or even at home talking about their anxiety a little bit more rather than avoiding it.
I still think like the number one thing that I do with anxiety for a lot of people is go to that like kind of head on. What's the worst case scenario? What are if this went terribly, what would happen? Right? And then we start talking about like, well, how would you deal with that? Right? Oftentimes with anxiety, we stop with it'll be terrible and I need to avoid it. I need to not have that happen. But when we actually talk about, well, if I failed that exam or if I didn't get that job or I was terrible at the job interview, or then we go, okay, what would happen? Right? We can actually kind of handle that and we actually have like different ways to cope with that.
Well, you dig down into a core belief, right? Like we call these sort of core beliefs of your worst nightmare. What is the worst thing that can happen? And that is like your biggest fear. That's like your core belief or core fear that now you've exposed it, and now we can also break it down, right? The way I sort of see it is like, okay, your core belief is sort of this brick wall, and we're going to deconstruct it brick by brick.
Yeah.
Why is it that this is such a fear?
Yeah, I like that. I say that a lot too. Let's break this down, right?
Yeah.
Because all together it just seems overwhelming and it is catastrophic. But when we start to break it down and then we start to look at like, okay, what are the actual chances, right? Let's say there's a 5% chance that that terrible thing happens, but there's like 95% chance that it doesn't, that, and then it was like, okay, that actually feels a bit different, right? I can
Hmm.
approach this thing differently.
Yeah. Or with the brick wall, I like using imagery, I like using metaphor. So it's sort of like we're going to punch a hole in that brick wall so that we can see the other side a little bit, right? I'm not saying that we have to break down the wall all at once,
Mhm.
but if we just can get a glimpse of the other side,
Yeah.
right? Then we're starting to break down and create little holes in this all-encompassing barrier that we're trying to defeat here.
Well, and using metaphors and different ways to create some flexible thinking, right? And
Yep.
get out of that really rigid black or white thinking. Because I mean, when we're stressed, when we're anxious, that's what our brain does. It looks for simple solutions, and it is not going to spend time kind of thinking about what is the chances of this happening. It's just going to go worst case, and I need to fight, flight, or freeze, or respond, or I need to worry about this thing because if this happens, it's going to be terrible, right?
Hmm.
So there's so many different techniques in terms of like even spending some time a day letting yourself worry, but like
Yep.
restricting it to like half an hour or an hour, right?
Yes.
Where you just let yourself worry, and then
Yep.
after that. But
Yep.
the other one too, that fear of flying, that one is
Yes.
like, some people they really benefit from like looking at what is the chance of a plane crash, right?
Hmm.
Versus
Yep.
driving, and
Yep.
like how driving is a lot riskier. But driving, you might be driving and be more in control of the vehicle, right? So
Right.
there's so many layers to these things, but being able
Yes.
to challenge some of those like beliefs that might not be really grounded in, statistics or
Yes.
yeah, percentage.
Yeah. So the way we think about it can be quite biased. I think the last piece I wanted to throw out there too is journaling. I found actually, even with some of my teenagers who I work with, we get creative with journaling. It's not just writing anymore because nobody really loves to write, but they will record what they're saying into their phones as a voice recorder. And as they hear it out loud, then they sort of start to see home. That particular fear or anxiety, yeah, that does sound a little bit ridiculous, or that doesn't sound quite right. And it just helps to get it out into the open.
Oh, I like that you brought that up, and I know we're super tight for time right now, but writing our words down is different than having those ideas or those words
Hmm.
like in our head, right?
Hmm.
And sometimes just even looking at our writing and reading our writing, and we go, "Oh my gosh, that's kind of ridiculous," right? Like,
Yep.
but when it's in our head, it doesn't feel like that. It feels true. And so, yeah.
And as we're writing too, it slows down our thought process because now you have to take it from the brain down onto the paper. And
Mm.
so as we slow down the way we're thinking and those spirals, it can actually help sort of stop us in our tracks and go, wait, hold on. What am I writing right now? Like, why is this such a huge deal?
Yeah. So writing about it, but also talking about it. That's why with therapy, right? Or even like in the men's group, like people giving an update to a group about what's going on for them, what they're worried about, what they're afraid of is
Yep,
different than having that just kind of rattle around in your own head.
exactly. All right, I know we're tight for time,
Yeah.
but I hope again we've structured this episode a little bit more with talking about the different diagnostics, talking about practical tips and strategies. And I have no doubt we're going to talk more about anxiety. It's such a rich topic.
Yeah, and it affects so many people, right? So
Exactly.
it's a bit overdue. So let's continue this. I think we'll do at least one more episode on anxiety.
Absolutely. All right. If you've liked this episode, you want to hear more, like, subscribe, tell a friend, tell the people around you. And until next time, take good care.
Take care, everyone.